One at 3, hurricane season in full swing, and we've already had one named storm so far. Now, with the hurricane season continuing through November, it is always important for us to be prepared for storms to hit our area. And Dr. Cory Harrow joins us today. He's the medical director at the ER at West Boca Medical Center. And Doctor, thank you so much for joining us today to talk about staying prepared. Let's begin with some of the key steps that really everyone should take to make sure that they are prepared for any potential storms.
For sure. So advanced planning is essential in limiting the danger associated with hurricane season here in Florida. So it all starts with having a well thought out plan. And that plan could include either sheltering in place or evacuation. But either way, from a medical perspective, having emergency supplies and an emergency kit is key. Absolutely. So that starts off first and foremost with a large supply of clean water. But it's not just for drinking. It's also because you need to wash out wounds and to prevent any overheating, especially in some of our elderly patients. Having a flashlight with batteries, because tripping over debris in the dark, you can fall, break a hip. You could be there for hours before help can come. Also having a well-charged cell phone with an external battery or power source to call for help just in that kind of a situation. And definitely having topical antibiotics and bandages, because a small scratch, which can fester for days, especially after being exposed to brackish water, can turn a small minor injury into a limb-threatening condition.
And Doctor, let's talk about any special or specific considerations for those individuals with medical conditions or special needs. What should they do or keep in mind when it comes to preparing?
Sure. So when we have patients who have special needs, or perhaps they're elderly, one thing that we definitely would recommend is not to be alone. Yeah. If you have cognitive issues or hearing issues, you may not be able to understand or follow instructions from local authorities. If you have mobility issues and you're dependent on home health care or home meal delivery, they may not get there for days and you'll be alone. And if electricity goes out, and most importantly, you lose your air conditioning, the elderly patient, especially if you're on medications which make it difficult to handle that, you can overheat, which can cause significant medical problems for our most delicate patients.
And Doctor, I would like to know how the emergency room process and the preparation looks like. Break that down for us.
Sure. The emergency department is the part of a larger hospital community. So when our hospital designs a hurricane preparedness alert, we go into a team approach, and we have Team A and Team B designed with doctors, nurses, techs in order to allow the hospital to function theoretically indefinitely, but it's certainly throughout the situation. We have hardworking staff members come with their own bedding and their own food, their designated places to sleep, so that they're able to work a 12-hour shift and then hand it over to their colleagues to work the next 12 hours, all designed to stay open 24/7, regardless of what's going on outside for our entire community.
And just lastly, any advice you would like to give our viewers this afternoon, especially for post-hurricane recovery, including potential health hazards or accessing medical care?
Following the instructions of local authorities is key. So any type of warning about downed power lines, about flooding, about the potability of water, if it's safe or not, you need to follow those to prevent injury. If you're trying to clean up debris using a ladder, be very mindful of having someone to steady it. A lot of us don't use ladders very often, myself included. And not having someone steady it, you can turn a small turn into a 10-foot fall, which is major trauma criteria associated with significant injuries.
All right, some great tips, great advice. Cory Harrow with the West Boca Medical Center. Thank you so much for joining us. All right.